to this one. And consider about the HLLT. We can give breaking PB apple and carbonization PC apple and vaporization VA apple and carbonization apple PCA apple. And so we have 3 types of treatment. LLT is a pure type of laser treatment. Only one reaction appears to the body. So in this case is MLT welding plus activation reaction in the same time. In this case is the HLLT plus MLLT plus LLT. We can so the auto simultaneous treatment we can have 2 types. Now I can summarize these kind of things as these reaction for late reaction might be called the irreversible one, and photodistraction occurs there. And this zone case is reversible photo welding type of treatment. We can call this MLLT or the WELT. And this treatment we call this destructive LLT, DELT and HLLT, or this zone is LLT or the ACLT, activation laser treatment. So these are the reversible reaction. And so these reaction cases, cells or the tissues might be alive. And so there might be a survival threshold of the cell might be exist. And so we have now the photoactivation reaction to the A zone. We call this the photoactivative reaction, PAR. And B case is the photowelding reaction, PBR. And C to F, we can call this photodistraction, so the PDR. Now, we can make this kind of laser treatment. The A zone, if we can use the A zone, low reactive level laser therapy, LLT, in other words, activative laser therapy, ACLT. Or in case of the minimum reactive level laser treatment, MLLT cases, we can give a welding laser reaction in the treatment. So the WELT, another word. And C to F zone, we can give a HLLT. It might be called the destructive type of laser treatment, DELT. And considering about the intensity, fluence, and also the photobiological reaction, if we can make this kind of line, Schultz said the very small stimuli cannot give any reaction to the body. But if it comes to some degree of the stimuli, and then it gives the activation to the body. But when it comes to the C zone, it's coming down. And then coming down to D cases, and we can, these are the activative zone. So this zone, I call this the activative zone. We can use this zone in the treatment of LLT or the activate ACLT. And so this zone, the MLLT and HLLT might be this zone. So I made this curve they named it Anschutz-Oshilow's curve. And this was the certified by Kenichiro Inomate, Toho University professor. He gives this reaction. LLT and KNPP are he used. And he gives these doses. And then the doses coming up, if it's coming to the 174%, it's coming down. And the 100 is the initial condition, and then it's coming down, and finally he can get these curves. So this curve, it looks like Anschutz-Oshilow's curve. And so I make of my Oshilow's new classification. So if we use a single laser treatment, single laser in the treatment, we can give pure laser treatment and also the auto-simultaneous laser treatment. In case of pure laser treatment, is the activation laser treatment. So the ACLT, we call this, or in other words, LLT. And auto-simultaneous laser treatment cases, it's divided into the welding laser treatment and diffractive laser treatment. Welding laser treatment, the WLT, or in other words, MLLT. The diffractive type of laser treatment, DLT, are subdivided into 4 categories. PB, PC, and VA and CALT. And other types of treatment, for example, the acoustics or photochemical or another reaction might be included this zone, OTLT. And if we use laser, multiple laser, not one, not two or three lasers in the same time in the treatment, we call it divided into the two categories, combined and compound laser treatment. Combined cases, if we use multiple laser in the one disease or the one symptom, in such cases, I named the combined laser treatment, CBLT. And compound laser treatment, it means if we vaporize skin into the dummies, and then sometimes coming up the hypertrophic condition. In such cases, afterwards, if we use argon laser, afterwards treat to stop hypertrophicness, and then this kind of treatment might be called compound laser treatment. And concomitant laser treatment cases, the conventional treatment plus laser treatment might be CCLT. Consider about the combined laser treatment. It's subdivided into like this. It's very difficult, complicated classification. So it might be, it's already written in some journals, in some papers. So you can see these kind of classification from my paper. And when, so that you can see here, the carbonization C-apple, CLT, the cases, we can show you the clinical cases. This one cutted by CO2 laser. So the CO2 CALT, we call it. And this was also CO2 CALT. treated by, this one is basal cell carcinoma case. No bleeding. So these can very small excision, we can give a good result. And this is all HLLT or VA application. Vaporization we carried out using UV laser, VALT, vaporize the small elevated tumor. Big tumor cutted by CO2 laser. And this is acrocodon cases. We vaporize it by CO2 laser. Defocused beam, we can get these conditions. This is CO2 VALT also. The burn skin surface vaporized to flatten the surface. This is protein coagulation cases. Yes, UV laser PCLT, we can give this condition using UV laser. It is also the PCLT of UV laser. This is the PCLT. Hemocoagulation occurs in the very high intensity of UV laser, give hemocoagulation soon after the irradiation. This might be called the PCLT. And now the protein breaking, photo denaturation or something, this kind of reaction might be included in here. Low intensity and long irradiation time, there the shrinkage occurs to the blood vessel. So we call this the argon laser PBLT. This is also the PBLT, another kind of. This is also the PBLT of argon laser. And the welding cases, yes, we can give a welding fusion to the blood vessel, not only the blood vessel, nerve, tendon, muscle, and skin. We can fuse this kind of welding reaction using a welding reaction. Now coming to the LLT for non-surgical treatment. In these cases, we are using a gallium aluminum diode AC activation ACLT, another word LLT. This is free frag. The necrotic condition appears, and so we rated these 3 points using gallium aluminum diode laser, 830 nanometer, 60 milliwatt, radiate onto these points, 15 seconds onto the 1 point. And then we can get these conditions. August 28th showed you as the 31st, and the September 3rd, September 6th. So this condition to this condition, we need only 2 weeks. Very interesting reaction. And this is Barger disease cases. Here, before treatment, these are the dry condition. Mummification occurs there. And then the three months later, we can get the wet necrosis condition. And finally, we can get this condition 15 months later. And this is the angiography condition. Before treatment, after treatment, 15 months later. You can the same level show you. This is the knee level. So from this position, he recommended to the